Are you a woman that has recently stopped taking hormonal birth control and noticed some troubling symptoms that seem to have appeared out of nowhere? Well, unfortunately, you're not alone, because many women do experience what is known as post-birth control syndrome, which is really a collection of symptoms that can arise within the first 4 to 6 months after discontinuing hormonal birth control and can last for months to even sometimes years. These symptoms do range from everything from a total loss of your period, problems with fertility, and even things like acne and hair loss. So the truth is that this happens because hormonal birth control really does create this situation where it shuts down the communication between our brain and our ovaries as women. And what happens then is that this takes over and we actually get the hormones while we're on birth control from the synthetic hormones that are in birth control. And many times too, women are put on birth control without even addressing the hormonal imbalances that were leading to symptoms. And so these women have underlying issues and concerns. And then when they come off birth control, they're magnified because now they're not getting that extra support by that sort of synthetic hormone support that was coming from the birth control. And so what I've seen in clinical practice really for years is that we're starting to really document and see there's women's stories and symptoms that after they've stopped using hormonal birth control, that what they find is that these women struggle in some way. And it makes sense because these drugs are designed to shut down your entire reproductive system. They halt the communication between your brain and ovaries and stop ovulation. You know, this is very effective in what it's meant to do, which is stop pregnancy and ovulation. There's still much that we don't fully understand about the long-term suppression of the reproductive system. And then also, you know, the repercussions of getting the body back on track and back in balance when it has been suppressed like this for years and now sometimes even decades before women come off of it to try to get pregnant. So there is evidence showing that side effects that may have started while on birth control do not always disappear after stopping it. These are issues like low libido, anxiety, depression, gut symptoms, inflammation, and even autoimmune disease. And these have been reported by many women. So unfortunately, some doctors just dismiss these symptoms and claim that they're all in their head. But I really want to go on the record and say that as a medical provider and somebody who's worked with women for a long time, that this is not what we're seeing. This is not in women's head. This is a very real thing. And in order to really get control of it, what we need to do is find the underlying root cause for each woman. We need to get the body's hormones back in balance, and we need to assess it properly. And that's usually through saliva or urine testing, and be able to really get to the underlying issues, causes, and imbalances in each woman. I often find too, so my clinical approach many times, besides just balancing the hormones, is also to look for any nutrient depletion. We do know that especially oral birth control can create certain deficiencies in the body, like B vitamins. And so to look for any of these deficiencies and to replenish the body. I also look to really restore the detoxification pathways in the body, because when we look at excessive hormones and just hormones in general, it's really up to the detoxification pathways to get the hormones under control. And so this includes, you know, giving support for the liver, doing things like castor oil packs, seed cycling, things like that that just naturally help both the liver and the body to just detoxify. Also, this can include and should include great liver-loving foods, things like green apples and beets and carrots, using things like the cruciferous vegetables like broccoli and cauliflower and kale. Brussels sprouts are also a great food for this, and then broccoli sprouts. You can also use things like dandelion root or dandelion root tea, burdock root, and things like that that just really help to be able to get the liver some support and to heal. And then the gut is a huge component. A lot of times, honestly, I find that where the hormonal issue started was the gut, and it was never addressed. But no matter what, you know, you really do have to go into a gut healing program. Make sure that you're not eating any foods or have any food sensitivities that are leading to more problems. Then also to help be able to support this detoxification of the body, you also have to make sure that you have a healthy gut. And this includes being on things like probiotics, L-glutamine, marshmallow and slippery elm bark. All of those things can really help to detoxify and heal the gut. And if you think that you have deeper gut issues, to definitely see a functional medicine provider and do the proper testing to look at your gut, look at your nutrient levels, look at your detoxification pathways, look at your hormone balance, because these are tests that can be done. They're just functional medicine and integrative practice tests that go into this kind of detail more than what you'll see from traditional medicine testing or just blood testing, if you can even convince your doctor to do those. And the most important thing, though, that I think is to know that you're not crazy. Many women do struggle with post-birth control syndrome, and that your symptoms are not something that you've made up. They're not due to anxiety. Many times I hear the story of women getting taken off birth control, having a lot of issues, and then being told, well, do you want an anti-anxiety, an antidepressive drug, because of the fact that there's really no other tools that sometimes traditional medicine has. So your symptoms are not in your head, and to go looking for answers. Listen to your body, trust your body, and know that sometimes those answers are more in functional medicine and integrative health, because the tests that we do are different and the treatments that we do are different. So all can be reversed, it can all be restored, and that, this isn't something that is doom or gloom, it's just the opposite. This is something that you can change, and I really want to empower women to know that, by really working with more functional medicine and natural healthcare, that we are able to help a lot of women with post-birth control syndrome. Also, we have made an amazing course, because I know that sometimes in this journey, information is hard to come by, and sometimes people don't have the resources or, the money to see functional medicine providers. So I've made an amazing course that's called Mastering Your Hormones Naturally. And it's really not only just made up of teaching women more about their hormones and going into depth about things that we can do naturally from not only functional medicine, but also in acupuncture with acupressure points and herbs and things like that. But it also includes a whole module and ebook on what products we need to take out that have higher levels of foreign estrogen and toxic to our body. Because when we look at hormone balance, it's not just about, what we need to do in order to balance our hormones, but also what do we need to avoid in order to really live an optimal life. And so the course that I've put together, which is linked in the comments, is a great place to start. And like I said, it's full of information, hours and hours of research and information went into this course from me, and also is meant to give you sort of my clinical experience of helping women, but then also, the ebooks that just have tons and tons of great information and applicable information so that you can not only start that journey, but really make the journey easier. So thanks, guys. And like always, if you have questions, please reach out to us at One Agora Health.